They're there to show that compassion and care for the elderly. They're supposed to protect them, and that is not at all what we got.
We got to have the information. We got to deal with that appropriately.
Frustration, anger, and disbelief. Family members who have loved ones inside a Fort Wayne nursing home say they were kept in the dark as COVID-19 infiltrated the building and began spreading among patients. That was in part one of our Digging Deeper investigation. Tonight, Brian McElhatton has more stories from worried families who say all nursing homes need to be open and transparent. Brian.
Well, we were first to pinpoint a case of COVID-19 inside the Bethlehem Woods Nursing and Rehabilitation using a death certificate that confirmed COVID-19 as the cause of death in one resident. And now we're hearing from more family members who are angry and frightened. This video gave us a hint of what was happening inside Bethlehem Woods. A gurney and staff members in protective equipment. But ABC 21's questions to the owners brought no answers, just a statement reinforcing the company's commitment to the health and welfare of residents and staff. Allen County health officials, they wouldn't confirm anything either.
We do leave it up to those facilities to release that information if they feel necessary, and we know some have and some have chosen not to, and that's up to them to do so.
And neither would the state's top doctor, Chris Box.
That would be information you would need to get through the facility.
And for families with loved ones inside Bethlehem Woods, each day brought that hollow pain of uncertainty.
Bethlehem Woods is showing us that they don't care about the families, and they really don't care about the residents because they're not communicating to any of us.
That's the voice of Anna. She says she has a family member with COVID-19 inside the nursing home, but she's afraid of retaliation and chose to speak with us over the phone.
You already can't have eyes on what's going on in the nursing home because there's no visitation allowed, and now you have a nursing home that is allowed to choose or not choose how they want to disclose their information to families and public.
According to Anna, nursing home staff called her family on April 9th to say that someone in the home had COVID-19. By then, she says, her loved one had already been moved several times within the building. But she claims her family wasn't told that their loved one had the virus until specifically asking about it a week later.
Communication is everything. And if you have no communication, how can you help anybody?
In the last week, nursing homes have been required to inform family members of COVID-19 cases immediately. That's a new directive from the state. But beyond that, they still aren't required to make that information public. And that's not good enough, according to Andy Eby, who runs a nursing home company that constantly updates the number of COVID-19 patients and their locations on its website.
And we believe that the kind of hide and hope strategy of healthcare is not the right strategy right now. We are encouraging other healthcare institutions, other senior living communities, long-term care, nursing homes, health departments to publish this information because that's the way that we're going to get through it.
Other states do make that information public. Ohio has a web page listing each nursing home and any cases it has. Illinois has a map. Michigan is beginning to report that information, and Kentucky maintains a list too, but not Indiana. Why? Well, that question was put to Health Commissioner Dr. Chris Box just days ago.
That is something that we can consider, but we've really tried to avoid that because we do think that this is a personal thing between the facility and the individuals who live in the facility and their families.
But that answer offers no comfort to Anna, who's reeling from the experience.
This isn't something that anyone on this globe really wanted. We're all just stuck dealing with it. Let's just be compassionate for lives and let's just keep people informed. Why is that a problem?
Now, we have since confirmed 2 COVID-19 related deaths at Bethlehem Woods. We're working to learn if there are more. We've also shared with you both Dr. Box and Allen County health officials do not plan to publicly release outbreak information at long-term nursing facilities by naming them. But today, Governor Holcomb answered a question during his daily briefing announcing no intention of his to force agencies to publicly report those numbers as well. Here's his explanation.
We respect that private business, that nursing home, that is operating under our regulations, and that's where the relationship exists. And by the way, we have taken a few extra steps to make sure that if that's not, that we're going to intervene, and we are.
Well, we will keep on this story for you as we work to understand how local nursing homes have been affected by COVID-19 and if Allen County health officials and their state counterparts begin naming individual homes. We'll be the first to let you know.